Hey everyone, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. This is part 2 of a hand therapy education video featuring carpal tunnel syndrome. So in this series, we are going through kind of almost like walking through essentially assessment and treatment of a patient with carpal tunnel syndrome. So I'm going to kind of share with you my thinking process and everything that I've learned so far. Again, I have been practicing for 4 years, so I do not know everything. I've seen a lot of carpal tunnel patients, but we are all in this together. We are all here to learn and grow and continue to provide the best possible care for our patients. So this video, we are going to be talking about evaluation and assessment. So we're going to kind of I'm going to walk you through essentially what goes through my mind and kind of my process for an initial evaluation when I know that the diagnosis has been given to me as carpal tunnel syndrome. Please feel free to chime in, comment below, ask questions. Everything is welcome here. If you feel like I'm missing something, or if you add something else on, or whatever it may be, I'm open to suggestions, and I want to learn more, obviously, as well as everyone else who's here wants to learn. So let's make this like an open discussion and kind of chat more. I hope you guys enjoy this video. Let's get into it. So the first thing that I usually start with in my evaluation as the patient sat down, of course I've kind of looked already at their posture. I'm looking to see if they've got kind of some forward neck posture, some rounded shoulders, or anything that could be causing some cervical impingement or other, kind of wonky looking anatomical features. But I usually like to start with the subjective component. So with that, I like to kind of ask them. I like to say, hey, I see this is the diagnosis that you've been given. Kind of tell me a little bit about what's been going on, what your symptoms are. So with subjective assessment, I like to ask them kind of how long has this been going on? How long have your symptoms been bothering you? Has it been, getting worse over time, or is it something that came on suddenly? What was the onset like? Was there an injury that happened, like your arm got crushed or something like that? Or was it something that you just started to notice over time? When do you feel the symptoms are the worst? It's common with carpal tunnel syndrome to have kind of that clinical hallmark of nocturnal numbness or tingling. So sometimes people, tend to have that. They'll kind of have to wake up and shake their hands to make it feel better. That's like the shake sign, right? Or the shake test. I like to ask them also, kind of to thoroughly describe the symptoms. Show me where you're feeling it. When does it come on? What are the aggravating and alleviating factors? Does anything make it better? Does anything make it worse? What kind of activities are you having trouble doing? Do you drop things a lot? Tell me about kind of what a day-to-day routine looks like for you, and kind of are you able to still do these activities. So just try to get as much information from them as you can. You can start to kind of develop your clinical picture from there and kind of start to form some ideas of where you might need to do your objective testing. So subjective is super important. Take the time to do it. Absolutely listen to them. Try to ask open-ended questions so that you're not just asking like yes or no questions, because sometimes you can kind of lead them. And that may not be, really the best assessment. You want to really get a full picture of what they're going through from them, not from you leading them to the answers. And then you can kind of move into your objective testing. That's what I typically like to do next. I like to just get these measurements out of the way. That way we can kind of start looking at what might actually be going on and kind of feel what things actually feel like. So with objective measurements, usually I start with range of motion. That's just my personal preference. I like to see how they're moving. I ask them, comparing contralaterally. That way honestly, I tend to have them do it at the same time, because they're not paying attention as much, or they're not hyper-focused on one side. And then they can kind of compare themselves too, and then they can see if they have deficits or if they're able to, complete the full movement. So I always start with range of motion actively, and then I will move on to kind of the grip and pinch strength testing using the dynamometer, the pinch gauge. I like to take all 3 pinches personally, because it doesn't take that long usually, and that way you can really assess if there are certain positions where they seem really weak, or if they seem like they're having more pain or something, or symptoms usually with that testing. So that's always a good place to start. From there, if you feel like you need to do some manual muscle testing, you can. Obviously, with carpal tunnel syndrome, you're going to be looking at the thenar muscles. Are they looking like they have some wasting going on? Look at the lumbrical muscles, see if they seem really weak in that position. And then I'll usually kind of assess kind of carpal mobility. So I'll feel their wrists, I'll feel kind of how those carpals are moving. A lot of times with carpal tunnel syndrome, the carpals have less mobility on that side than on the other. And kind of just test some different gliding. If I need to do like an upper limb tension test, I can. I don't always do that on the first visit because I think assessment can be kind of continual. You can kind of build your clinical picture over time. And then, you can kind of get into your special tests too at that time. So some of the special tests for carpal tunnel are Phelan's, right? Doing the tapping. You can kind of start at the fingertip, coming down. Usually you want to start at like kind of the longest point of the nerve, which for the median nerve is going to be the long finger, right? So you can kind of tap along the sides of the long finger down, tap right over the carpal tunnel, see what their symptoms are. Usually you don't want to just do Tinel's because it's not always the most like specific test or most sensitive test, I guess. You can do Phelan's where you're having them kind of put their wrists together and then holding, and then usually you just want to kind of have them sit here and then they can tell you when they start to go numb or tingly, and you can time it, and that's like a good little special test that you can do. You can also do the Dirkman compression test, which you can kind of look. It's hard for me to show you that on myself because I don't have the right positioning, but essentially you're using your thumb and you're putting pressure like kind of down over that carpal tunnel, and again you want to time it, see how long it takes for them to get numbness or tingling. You can also do kind of like I am gonna probably mess this name up. I don't know why it always confuses me. It's like the Berger lumbrical test. So when we bend our fingers into a fist, the lumbricals actually translate down a little bit into the carpal tunnel. And so some people, you may notice that some people don't get better with just a wrist splint. They feel like they start to get a little better, but it's not super effective. So sometimes you actually have to take it up to over the MP joint because that blocks the lumbricals from gliding down. So just another like good assessment that you can kind of use for that. So those are just some of the kind of physical special tests that you can do for carpal tunnel syndrome. Sometimes you may need to test like things like coordination, or you can test sensation as well, doing like 2-point discrimination testing, or you can do the Semmes-Weinstein testing. The clinic that I work in, I don't typically do that on the first visit just because it's like a time constraint. It just takes a long time to do all these different tests. And you can kind of assess that as you go along with your treatment as well. Like you could maybe give them the 9-hole peg test as like a little activity, or you can see even with the pegs, if you're not doing the standardized test, you can just have them like do some in-hand manipulation and see how they are with that. You can have them do some different activities and sort of assess that later. So it's just personal preference and time management too. Also really important to assess is posture, right? So take a look at what they look like when they come in. Do they have forward head posture? Do they have rounded shoulders? See how they look when they're walking, standing, sitting. If you can assess them in multiple positions, that helps. Take a look at movement patterns. Do a quick cervical range of motion screen. See if one side looks different than the other. Check their shoulder movement. You also always want to look at ergonomics, right? And not just in an office setting. Ergonomics apply to everything that we do. Whatever activities seem to bother them, take a look at how they're sitting, what their posture looks like. Do they have wrists flexed or resting down on surfaces? It's really important to kind of look at all of those things as you're assessing, because the whole extremity really links together. So it's really important to take a look at all these things in order to know what you're going to address in your treatment. So that was a very rambly discussion, but I hope that it was helpful in just kind of walking you through what my initial assessment kind of starts to look like. This is not an all-inclusive list. Again, not every patient is the same. We can't do everything the same every single time, but this is just giving you kind of a jumping off point. So if you're a new practitioner or you're new to hand therapy, a new grad, a fieldwork student, it's something to start you off and kind of what you should be starting to look for when you're doing your initial evaluation. If you can get really good at assessing the issues that are going on and kind of interpreting the findings of your initial evaluation, that is going to help you get a better outcome for your patients. So something very important to work on. I hope this video was helpful. If you enjoyed it, please give it a thumbs up. Feel free to comment below if you think I missed anything, or if you have something to add, please join the discussion. That's how we all grow together. And please subscribe to the channel if you haven't yet. Thank you guys so much for watching, and stay tuned for part 3, where we're going to move into talking through some treatment ideas for carpal tunnel syndrome.